Hi there, my name is Dr. Elliot Lysyk with Arise Wellness Center, and over the last several weeks I have spent quite a bit of time discussing and creating a foundation for people to understand the basic mechanics of nerve interference, what spinal inflammation is and how it's caused, how the piezoelectric nature of bone can actually lead to the formation of arthritis based on these imbalances, and how over time these imbalances can actually get bigger and bigger and bigger, causing more and more damaging arthritis consequences as time passes on. And now what I want to do is just take a little bit of time to explore the relationship between spinal imbalances, what a vertebral subluxation is, and then how that relates to some of the most common health conditions that people suffer from. One of the conditions that seem to come up for chiropractors and doctors across the world quite commonly in their patients is neck pain, headaches, and migraine pain. And it's so common that lots of people take time off work for migraines and headaches. Oftentimes, headaches can happen in conjunction with neck pain or independent of it. Sometimes migraines can be quite sporadic, or they can cluster, they can form certain patterns. One of the things that I've recognized in my practice over all these years and all the patients that I've seen is that a great majority of the headache pain that people experience is actually referred from the neck. And something called cervicalgenic headaches is actually a category of headaches that is often overlooked precisely because typically an exam doesn't include the neck when someone has a headache. And what we see in practice is that when people lose that very gentle, natural forward curve in their neck, the spinal joints in your neck, they get damaged, they get grindy, they get pinchy, they get sandpapery, and they pinch nerves that have very specific referral patterns to certain parts in the head. So when we as chiropractors work to restore that lovely curve in the neck called the lordosis, what we notice is these cervicogenic headaches, these neck-created headaches, will tend to go away. And a great majority of the people that come to us with headaches or migraine pain will have such astounding relief, either a complete cessation of their pain or a dramatic improvement, and they'll kind of wonder why no one told them that the nerves in their neck actually in a large degree do create and move towards causing headaches. So you might ask yourself, why would someone lose the curve in their neck? And to give you a quick story, I had an 11-year-old patient of mine going back a couple of years. He came walking into the practice, he had an ice bag on his neck, his head was shoved forward, and his principal, who was a patient of mine as well, referred him into the practice because he just got struck in the neck with a lacrosse stick. And I took an x-ray to see how much damage there was, and he had completely lost the curve in his neck. So a few adjustments later, there was a complete improvement in his condition, 100% correction, and the curve was restored back in his neck. So there's just one example. Cross-checks in sports, falls and slips, sports accidents, slips on the ice. When you're learning how to walk, you actually fall typically about 1,500 times as a tiny toddler. And then there's car accidents and rear enders and fender benders and you name it. All these things accumulate over time. Poor posture, poor sleeping habits, and they can cause a loss of that curve, which typically leads to the neck pain, headaches, and migraine pain. So a careful exam by your chiropractor for these small imbalances in your neck joints and your spine's alignment could actually reveal why you're having these neck pains, migraine pains, and headache pains. Next week, I'm going to cover the topic of breathing difficulty, labored breathing, things like asthma and things that restrict people's breathing, and find out why there's a relationship between the body's alignment and those functions. And recently I became intimately aware of just how important alignment and rib integrity is for breathing because I fell off my mountain bike and broke 5 ribs and bruised my liver. So I'm on the mend. Look forward to my next week's words, and in the meantime, have an awesome week. We'll talk to you soon.